In this video we are going to cover some difficult topics such as the temporal, infratemporal and the pterygopalatine fossae and their contents. And first of all I want to show you this indentation on both sides of the skull. And we have the temporal fossa here, which is filled by the temporalis muscle. And this grayish shadow inside of this fossa you see all the way around, it belongs to the temporalis muscle. The auricles appear on both sides of the head. You see them here, very cute structures. Well, as I go further down, the zygomatic arch appears on the lateral side, and this arch, it tells us that we are not in the temporal fossa anymore, but in the infratemporal fossa, with the maxillary bone in front and the temporal bone and sphenoidal bone behind. This oval-shaped shadow on the temporal bone you see here is the mandibular fossa. The head of the mandible ascends up here to make the temporomandibular joint. And we have some specific muscles inside of the infratemporal fossa which move this joint. To differentiate these muscles, we need to identify the pterygoid processes first, and these two projections from the base of the skull, which you see close to the midline on both sides, they are the pterygoid processes of the sphenoid. As you see, they are made by two plates, the lateral plate of the pterygoid process and the medial plate. And if you see these plates, it's quite easy to differentiate the pterygoid muscles. The one which is attached to the lateral pterygoid plate is the lateral pterygoid muscle. Here it is. It connects the lateral pterygoid plate with the neck and head of the mandible. And the muscle which attaches to the middle pterygoid plate, a little bit medially, is the middle pterygoid muscle. The other two muscles which you see here on the lateral side are the temporalis. Remember, it descends down to attach to the ramus of the mandible, and we see its tendon here. And the one large muscle on the lateral side, there is the masseter muscle itself. So at the level where we have the lateral and medial pterygoid plates, we have four muscles in their visual field to differentiate. But as they scroll down to the level of the ramus of the mandible, here where we have no more pterygoid processes any longer, we see just two muscles on both sides of the ramus of the mandible, and the ramus of the mandible is sandwiched between them. The one which is inside is the middle pterygoid muscle, and the one which is outside here is the masseter muscle. The muscles of mastication are much better visible on the MRI. The main challenge here is the bones are hypointense, so you cannot see the bones clearly, but muscles themselves are quite well depicted. And now you see the oval-shaped structures just lateral and behind. They are the heads of the mandible, and the obliquely running muscles here are the lateral pterygoid muscles. What about other muscles? They are also present on this image, although you cannot see the lateral and medial pterygoid plate clearly, but this piece of hypointense area here is the middle pterygoid muscle. Here we have the termination of the temporalis muscle, and the large muscle outside here is the masseter itself. Okay, let's look at the second image below here, the second area of evaluation. The ramus of the mandible is in the middle and two muscles on both sides. The middle pterygoid is inside and the masseter is outside. Well, all these muscles will work at the TMJ, and the best way to assess the TMJ is to look at it at the sagittal image. As I scroll from the midline laterally, You can see the lateral pterygoid muscle again as it runs from the lateral pterygoid plate towards the head of the mandible, and here is the head and neck of the mandible themselves. Just above then the head of the mandible, you can see the articular tubercle and mandibular fossa, and this dark space between the head of the mandible and the temporal bone above is filled by the articular disc. You remember this disc has the posterior band and anterior band, and posterior band normally is located at the 12 o'clock, and we have no pathology in our patient. Don't forget about the second temporomandibular joint on the opposite side of the head. You need to scroll back and to find the second one and compare it with the joint you have already seen.